Congratulations, surgery's over. Everything went perfect. You're probably home now, and I just wanted to go through the instructions with you. You have all of this in writing, and so if you need something to refer to, please look at your blue post-op instruction sheet. Number one, you're gonna start your ice packs. Ice is gonna be your best friend for the next 48 hours. You'll do it 15 minutes on, 15 minutes off, except when you're sleeping. You don't have to do the ice through the night. We want you to get your rest so you can heal. Speaking of rest, we want you to try your best for the first 48 hours to sleep with the head of your bed elevated, with your head elevated. You can prop yourself up on a few pillows. Some people can sleep on a recliner. You can do that if it works for you. But basically, do your best. This is not something you have to adhere to extremely strictly. A lot of people say, well, I started elevated, but then, eventually I fell asleep and I ended up flat. It's not a disaster. If that happens, just do your best. The reason why we do that is we want gravity to be your friend. You're gonna have normal swelling, which we call postoperative edema, which is a normal part of how the body heals after surgery. And gravity helps move that edema down away from your eyelids quicker. So that's why we ask you to do that. We just want you to heal quickly. Number three, after finishing the first 48 hours of ice packs, you're gonna be switching over to warm compresses. Most patients say this feels really good. We'll help you get a hold of some warm compresses if you need some help. So contact our surgery scheduling team if you need help. Antibiotic ointment, it's called Tobradex. It's a combination of antibiotic and steroid. Antibiotic obviously helps to prevent infection, which is extraordinarily rare after eyelid surgery. So the main reason for that is we want that anti-inflammatory effect of the steroid. It just helps to take the swelling down faster. So do that 3 times a day. The ointment can blur your vision if it goes directly in the eye, which is okay. So the best time to do that is when you first get up in the morning and before you go to bed at night, and then you just have to find one other time in the middle of the day to do it. And avoid any eye makeup or any water activities for the first couple weeks until your stitches are removed. And again, this is not an extremely strict thing. You can take a shower. We want you to maintain your personal hygiene. When you shower, let the water run down over your eyes. Pat it dry with a towel. Just don't rub your eyelids. We don't want you to accidentally break a stitch, of course. And in terms of makeup, what I say is, for the most part, hold off on makeup, especially eye makeup. Now, if you have some kind of activity where you just do want to wear a little bit, it's not a disaster if you do put a little bit of makeup on. I would say just take it off as soon as you can. The same rule applies with contact lenses. If you really want to do, say, for example, a sporting activity, and you want to wear your contacts during that activity, that is fine. Just keep it to a minimum, wear them for a short while, take them out as soon as possible afterwards. Arnica Forte, which you bought prior to surgery and hopefully started for the first 2 days prior to surgery. We recommend continuing that for 5 days after surgery for a total of 7 days. If somehow you didn't do that prior to surgery, it's not a disaster. We want you to take that for a total of 7 days, so just start the clock now. Any systemic medications, any pills that you take, that one's easy, just start them now, back to normal. And if you have any discomfort after the surgery, you may take some extra strength Tylenol. 1 or 2 is pretty normal to take the night after surgery. It's optional. Most people say that they have no pain at all after the surgery, so you shouldn't need that. But you have that available as an option.